Many people often apply extreme diets to achieve their goal of having an ideal body weight. Not a few also take slimming drugs that are widely sold in the market. This is very dangerous, you know. The reason is, a healthy diet takes a long time and involves a healthy lifestyle too. According to clinical nutrition Dr. Diana, most slimming drugs that can lose weight work by reducing fluids in the body. Before we continue discussing the topic this time, press the subscribe button so you don't miss another information. If we talk about body weight, yes, that body weight consists of many compositions. There are bones, there are muscles, there are fluids, there are organs, there are fat. We continue to pee, said Dr. Diana in the eLife program. So, what happens? The fluid in our body also decreases. So, if we weigh body weight, the scale goes down. Obviously, because of what? The fluid is lost, he continued. Dr. Diana then said that one of the ingredients in these drugs, which can cause someone who is consuming it to urinate frequently, is a diuretic. With reduced fluids in the body, this can certainly disrupt the balance and metabolic processes in the body. What must be considered is that our bodies consist of 60 to 70% fluids. If we lose a large amount of fluid, yes, it can interfere with the processes in the body. In metabolism, the balance of the electron fluid is disturbed. Be careful, he said. Furthermore, Dr. Diana said that the administration of drugs to lose weight cannot be given arbitrarily and must be adjusted to the patient's condition. Because everyone certainly has different body conditions. On the other hand, the use of slimming drugs that are sold in the market can damage organs. There are many people who consume the drugs that are sold, they damage the organs. Got a kidney, stomach, wow, a lot. Anyway, do not carelessly. Do not carelessly consume diet drugs. Because of that, the effect is a danger to the survival of the organs, he concluded.